This is Daniel Cher, MD, Head of Clinical Affairs at SI-BONE. I'm here to tell you about a study recently published in Medical Devices, Evidence, and Research. Please note that the Insight and Sci-Fi trials, whose data are analyzed in this report, were sponsored by SI-BONE, and I am an SI-BONE employee. Sacroiliac joint dysfunction is an accepted cause of chronic low back pain. There is substantial evidence from the clinical literature using both normal volunteers and affected patients to support the SI joint as a valid source of pain. Non-surgical treatment of SI joint pain is commonly provided, but it commonly fails to relieve pain and dysfunction. Recently, devices for minimally invasive SI joint fusion have become available, and there is now increasing evidence supporting the safety and effectiveness of this procedure. However, SI joint pain remains an under-recognized condition. We wondered how quality of life in patients with diagnosed SI joint pain compares with other spine conditions commonly treated surgically. To answer this question, we compared baseline quality of life data from two sets of prospective clinical trials. The first set was two trials of patients undergoing minimally invasive SI joint fusion. The second set was three trials of patients with lumbar spine conditions commonly treated surgically. Collectively, these are the SPORT trials. Why did we choose these trials? First, 4 of the 5 trials, shown in green, are landmark surgery versus non-surgery randomized controlled trials with planned long-term follow-up. Trials were similar in design and conducted in the United States. Second, all trials measured quality of life using 2 commonly used measures, EQ-5D and SF-36. We obtained SPORT data from SPORT study investigators and combined them with data from our SI joint fusion trials. We examined baseline SF-36 and EQ-5D values, adjusting for potential covariates such as age, sex, body mass index, and baseline disability as measured by Oswestry Disability Index. This graph shows EQ-5D time trade-off utility, a measure of health-related quality of life, on the y-axis, and Oswestry Disability Index on the x-axis. The lines represent smoothed fits. SI joint fusion trials are shown in green and SPORT trials are shown in blue. First, we noticed that as ODI increased, indicating increased disability due to back pain, quality of life, as measured by EQ-5D, decreased. This, of course, makes sense. We were struck by how, at any ODI level, EQ-5D quality of life measurements were at least as low, or perhaps even lower, in the SI joint group compared to the other groups. Multivariate regression analysis confirmed this finding. This graph shows a similar relationship between SF-36 physical component summary and Oswestry Disability Index. As ODI increases, indicating increased disability due to back pain, quality of life in the physical domain, as measured by PCS, decreases. Similar to the prior graph, at any level of ODI, the PCS values in the SI joint cohorts were at least as low as in the SPORT cohorts. Further analysis is provided in the published article. Based on this analysis, we concluded that at baseline, quality of life in patients participating in our SI joint fusion trials was as depressed as that seen in other lumbar spine conditions surgeons commonly treat with surgery. The implication is that SI joint dysfunction brings a marked impact on quality of life, one that should be recognized by surgeons caring for patients with serious spine conditions. Thanks for listening and enjoy the article.